There's no doubt that the cannabinoids found in marijuana have a wide variety of medical benefits. But some people do suffer from cannabis use disorder. What is this? Let's talk about it. Hey everybody, it's Dr. David. Hope you're having a good day. As somebody who has been a certifier for medical cannabis since 2016, I've had now, geez, that's 7 years of experience in working with patients who are using this effectively, and most are handling it with no problems whatsoever. Okay, now we know that there has been overall a very significant increase in just legalization use nationwide. Okay, so many states have full legalization. Even more of them have a medical use only. But this is something that is becoming more and more common, as well as more accepted in the medical field. I am getting a lot more referrals from other physicians about the use of medical cannabis. Of course, I think it's because we've shown that we really focus on education and proper med management, and helping people understand how to properly use all of the different types of ingredients that are found in cannabis, between the different cannabinoids and the terpenes, and but also how you can actually do it in a proper way to make sure that you're getting the best benefit and also minimizing any negativity from it. Now, we are also looking at a situation in Florida where it seems as if there's a pretty good chance that marijuana for legalization for recreational purposes will be on the ballot here in Florida in 2024. Now, they've already received enough of the signatures for people to petition to put it on the ballot in the first place, and they were very smart in the way that the people who wrote this up, because the Florida law says that you can only have one particular issue, one particular item that can be made a constitutional amendment. So they really pared it down for this. Okay, now the state Supreme Court here in Florida still needs to give a final approval to make sure that it hits all of the statute laws in order to be put forward. But from what we're hearing, it seems as if it's okay. And let's face it, thankfully, marijuana is kind of a bipartisan or nonpartisan issue at this point. But of course, we need to be careful with how we're using, because this is still a drug that has mood altering and other types of altering effects to it. Okay, so there is this thing called cannabis use disorder. It's a formal diagnosis. Okay, and I'm going to read to you the criteria just so that you kind of really know what it is. And as with most mental health or other types of behavioral health conditions, there's not a test for this. Okay, there's usually a list of so many symptoms, and then if you have so many of those symptoms, then you qualify and you have that diagnosis. Okay, so in cannabis use disorder, there needs to be at least two or more of the following: craving of cannabis, becoming tolerant, so therefore you're needing more and more of a dose in order to get the desired effect. Using more that's intended. So there are some people who, just because it's there, may use it more and more, or a lot of people who find that the effects of cannabis are the best the first time they use it, and then they're kind of trying to catch up to themselves the rest of the day by redosing and redosing, but it doesn't really work that way. Usually it does have the best effect when first used, especially and for those who are looking for the euphoric effect for it, but the medicinal effect in terms of the pain and the inflammation, that does stick around. Okay. Okay, and of course, and using it even though it causes a problem in people's lives. Okay, so there are people who do get more anxious from this. You can even have panic attacks, but they want, well, there's the high or there's some other benefit to it, so that they're continuing to use it. If obviously it can affect relationships, especially if people are becoming aloof or forgetful, etc., like that. But they keep on using it despite that negativity for themselves or others around them. Okay, using it in high risk situations. Okay, driving a car, operating heavy machinery, when you're watching your children. Okay, there are obviously certain times in life where it may be more appropriate, even from a recreational perspective, to use it, but there would certainly be some other times, taking it in school, even before school. So that's obviously very illegal for anybody to bring it into school, but that's obviously a high risk situation, because the individual is putting themselves at risk, or at work at the same time, in terms of being able to perform, do well at school, etc., and also experiencing withdrawal and being unable to quit. Now, usually the withdrawal is not a physical withdrawal. Usually it's more a person doesn't feel as well, so they want to use it again to kind of get that feeling back. But if a person experiences any two, that's enough to make the diagnosis. Now, cannabis use disorder is certainly common throughout wherever cannabis use is, but and that's true even when there are robust medical marijuana programs in that particular state. Now, there are no current FDA-approved medications for cannabis use disorder. Now, certainly we have found cannabis to be useful in getting people off of other addictions. We see that quite often, but there's no actual medication to kind of balance this out. And so most of the types of treatments are more behavioral based, or maybe dealing with a specialty addiction center, etc., because some people do need to go through those types of things as the only way if they can get off of it, again, if there is a use disorder. Okay. Now, in terms of cannabis use disorder itself, people who have this diagnosis, they are more likely to develop a mental disorder. They're more likely to have cognitive deficits. They're more likely to use psychiatric services or need to be hospitalized because of it, and sometimes even violent behaviors towards themselves or others. So it does not mean that, first of all, everybody doesn't get cannabis use disorder. It doesn't mean that if you have it, you're going to get this, but they're found even more likely in the research that's been done. So in terms of some of the research itself, there's a really good study that I found from Washington State, from the state of Washington. This was a recent study where they took a group of 1,500 people who had used cannabis in the prior 30 days, and they asked the questions there. And interestingly, those who reported non-medical use, just recreational use, they were actually at a greater risk of having moderate to severe cannabis use disorder. Okay. Those who were medical may not, but it's also understood those who have or use it medically or have a medical card, they may not report it to their provider because they may be concerned that they would be cut off if they're having this disorder. So there may very well be some underreporting when it comes to medical, to those in the medical marijuana world and have their cards. Now, in 2020, there was this meta-analysis. So a meta-analysis is when lots of studies are put together into one bigger study. They have very complicated ways of manipulating the statistics to kind of make more of a, if you go from an apples to oranges to at least making a green apples to red apples type of comparison. And this was done like in the United States, in the Netherlands, in Germany, in Austria and New Zealand and France. Oh, and Ireland, excuse me. And in this study, they did find that 22% of cannabis users went on at some point to develop a cannabis use disorder. And that risk actually went up to 33% for younger users, I should say, who engaged in weekly or daily use. In addition to that, there was another study in Canada, and they found that cannabis use disorder went up from 17% to 24%, comparing before marijuana was legalized until after it was legalized in Canada. So, it's clear that the numbers are showing that this can be a problem for some people. Okay. Now, in terms of my takeaway on this, so first of all, while a strong percentage of people do not develop cannabis use disorder, it's imperative for people to be aware of it. Okay, it's imperative for doctors to be aware of it. It's imperative for doctors to be screening for it. It's something that we do in our questionnaire for follow-up to see if any of these things are becoming a problem for people. If people are requesting more and more and more each time, that's certainly a concern. But of course, so all types of community awareness, you may know a family member or something who, again, is it having a negative impact on the patient or on the person and those around them? Okay. Now, that is also the reason why I also talk so much about the other cannabinoids. The CBD is kind of just a general benefit overall, which also lowers the intoxicating effect or can stop from the THC. I know I've talked about that before, but I also like to talk about CBN for improving sleep and CBG for improving moods, anxieties, behaviors, CBGA for pain and inflammation. So there's so much more out there besides THC that can help people out when they need it. Okay. And of course, from my perspective, making sure that the root cause of a person's disease is looked at in the first place. And that's where our functional medicine work comes in for those who want to do that. But also, again, if you're not asking the questions, if you don't ask, you can't find. Right. And so that's something that's really important. So, something that we all need to be aware that this is happening. And certainly I would anticipate over time that cannabis use will continue to go up in our country as it becomes more legalized and more accepted. Have a nice day.